All right, guys, welcome back. Dr. Grubner here. Thanks for joining. As always, these are educational videos. If you have a real case scenario, obviously you should ask or follow medical advice, unless you are the medical advice because you're a doctor. If you're watching this, probably. All right, here's a guy that I drew, which I'm very proud of. And what does this have to do with anything? I like to talk about general thinking about a patient with a low value of any sort. I think it's helpful sometimes, right? Let's say someone has something, low something, high something, anything. We could generate a list of differential of like 50 different things, which is maybe what we're taught in med school. You just go bum, 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 generate like a massive list of things. I don't think that's always so helpful. Usually it's more helpful to kind of break it down and say, well, let's think of the broad categories that could be going on. Bucket 1, bucket 2, bucket 3. Let's put a bunch of diagnoses in each one of those buckets, and let's figure out which one of the buckets it is. This is taught in med school for some reason, I don't know why, but when we talk about AKI, this is a very common method that we do. We say, is it pre-renal bucket, is it intrinsic renal bucket, or is it post-renal bucket? That's like what we're taught. I think we can do that for a lot more than just AKI. I think we can do that for a lot of things that go on in the hospital. You guys, if you're watching this, are gonna be residents or you're already residents. And I think, you get a call at 2 a.m. in the middle of the night, or you admit a patient in the middle of the night. We should train ourselves, and is what I did throughout my residency, to start thinking in terms of like big buckets, not just for AKI, but really for everything. It's just an easier way. It's like in bite-sized chunks. You say, all right, bucket 1, bucket 2, bucket 3. Let's talk about this dude here, and let's talk about any value of anything which is low. So you get a blood test and something is low. Potassium is low. Hemoglobin is low. Your calcium is low. Your sodium is low. Anything. And I like to think about in my head just kind of like overall buckets. Now, how do things get low? Where do they go? Okay, so let's take this dude here and we're gonna say 1, 2, and 3. We're gonna say that there's really 3 different overall buckets, categories to think about when you notice that something is low in a patient. Let's just take something like potassium, which is I did a video on before, but here we're gonna just kind of use it as our example. So potassium is low. We check this person's blood and he has low potassium. The 3 ways to think about it are, number 1, is there a problem with intake? So this is his mouth, right? The upper half of his body. Maybe there's just a decrease in intake, and in some lab values, what that will also mean is a decrease in production. And what I mean is, let's say you're thinking about anemia, so low hemoglobin. That doesn't really fit with decrease in intake, but let's call that decreased production in the bone marrow. So that will be our bucket number 1. Something is low, let's immediately think and say, hey, maybe there's just not enough of it coming into the body, or there's not enough of it being produced in the body. Number 2, this is the middle part of his body. This is kind of just representative. This is my cool cartoon dude. Why is this low? Potassium, is it hiding inside the body? That means there is enough production and it's not getting lost. It's not leaving the body. It's hiding in there somewhere. Or the other way to say this, either it's hiding or it's being destroyed in the body. That would be more like, think about in the example of hemoglobin, maybe there's some hemolysis. We're going to talk about all these individually. We'll talk about potassium, we'll talk about hemoglobin, but this is just a general way. When someone has a low lab value, we can say 3 buckets. Is there not enough coming in? Is it coming in, but it's getting hidden or destroyed somewhere in the body? And then the bottom half of the body, I hope this is not too vulgar, is representing that whatever we're measuring is being lost. How do things get lost from the body? Well, we sweat a little bit, but that's not really a massive way that things get lost. Usually it's through urine, stool, vomit. It's coming out of one of the body orifices. So that's just going to be represented by the lower half of the body, and that is a loss. Okay? I think this is super helpful. I forgot even who taught this to me, but I've used this throughout my residency. Let's talk about a few examples again. So, anemia. Someone has anemia, you don't know why, it's 2 o'clock in the morning. Immediately you can say, is there a bone marrow problem, it's not being produced? Is there a hemolysis problem, it's in the body, it's produced, but it's getting destroyed somewhere in the body? Or is there a loss, maybe there's a bleed somewhere, GI bleed, maybe there's urine coming out, maybe there's blood in the urine. Potassium. Why is there low potassium? Well, immediately, let's say maybe PO intake is poor, the person nutritional deficiency is not taking enough potassium in the diet. Category number 2, bucket number 2, maybe it's getting lost in the body, i.e. it's getting driven into the cells. You can watch my potassium video to get more explanation of that. Or category number 3, maybe potassium is being lost in the stool or it's being lost in the urine. Sodium. Why is the sodium low? Well, maybe this person is just nutritionally deficient, is not eating enough sodium. Category number 2, maybe it's getting hidden or lost in the body. What we mean by that is maybe there's tons and tons of water in the body which is diluting the sodium and it's getting hidden or lost, and that's why the person has a low sodium. Or category number 3, maybe they have cerebral salt wasting. Maybe they're just peeing out all that, something like that, or DI, diabetes insipidus, or for some reason they are just losing all of the sodium and it's just getting lost in their stool, getting lost in their urine. I hope this was helpful. Again, I think this works for almost anything you could think of. When there is a low value, you kind of think of it in your head in these 3 buckets, and I found this to be super, super helpful. Hope you guys enjoyed. Dr. Ari Grubner, join me next time.